Happy Wednesday, everybody, and happy Women's History Month. Excited to talk to you today about our part 2 section of vaginal and front hole health. Today we'll be going over kind of a review of last week, which is, vaginal anatomy and signs that it might be time to go to the doctor, as well as what infections to look out for and kind of what their symptoms are. We'll give folks a few seconds to filter in and then get started. Also, again, happy Women's History Month. I pinned a comment in the chat. If you are a person who is looking to get tested for HIV or STIs, you can always do that with Whitman-Walker. Just give us a call at 202-797-4439. And welcome Whitman-Walker to the space. Hopefully Instagram lets you join any second now. Welcome everyone. Hope you're enjoying the super beautiful weather today. Currently Instagram doesn't want us to be great. Okay, just kidding. Spoke too soon. Welcome to the space. Thanks for being here. But cool. On that note, we'll get started. During the COVID-19 pandemic, Whitman-Walker's Community Health Department has expanded its outreach to social media. We cover various topics, including HIV, STIs, sexual health, practices, access to care, social determinants of health, and public health interventions. The community health team is here to educate and support you. My name is Jewel, and I use she, her, hers pronouns. Today we're going to be discussing vaginal health and sex-assigned female at birth health part 2. This will include a quick overview of some of the topics we went over last week, like the anatomy down there, tips on kind of caring for your vagina or front hole, and signs of infection, and just the name of a few different infections. These tools can be helpful for you, or if you are a person who has sex with someone who has a vagina or front hole, this will help you kind of help them diagnose anything that might be going on down there as well. So yeah, we will jump right in. So starting from last week, let's go for a few just review points. So the anatomy, the vagina or vaginal canal solely refers to the vaginal hole where babies can be delivered from and where insertive or penetrative sex happens. But the full area down there is known as the vulva, which includes the vaginal/front hole opening, the inner and outer labia, or labia minora and labia majora. These are kind of the vaginal lips, the clitoris and clitoral hood, the mons pubis, which is just the region where all of the pubes or pubic hair grows from, and then the urethra, which is where urine or pee comes from. A few facts that we talked about last week. The clitoris is a much more sensitive muscle than the penis, holding 8,000 nerve endings, and that's twice as many nerve endings as the penis has. It's the key to pleasuring a person with the clitoris, despite the large social emphasis on insertive and penetrative sex. The vagina is self-lubricating. We also learned last week that a vagina or front hole, as it ages, will kind of lose some of its gift to be self-lubricating because it loses hormones over the years of being on this earth. So with that in mind, lube goes a long way for more pleasurable and safer sex. Lube can help prevent rips, tears, and cuts in the vagina, which is super important because rips and cuts and tears is where STIs can more easily transmit to folks, and so it's super important, especially if you're having unprotected sex or condomless sex or barrier-free sex, that you explore lube as an option to help reduce some of those tears and rips and help decrease your chance of getting an STI that way. And then on a related fun fact, the silicone-based lube will stay wetter for longer than water-based lube. Next fact is that it's super important to urinate or pee after sex or intercourse. I actually heard last week back from a few folks that like they shared the various points in life at which they learned that fact and how it was, much later in life than uh, anyone who's sexually active would want to learn this fact. So if you don't pee after sex, you put yourself at greater risk of developing a UTI. This is a urinary tract infection, and it's when bacteria gets into the urethra and may cause painful or frequent urination. So by peeing after sex, you kind of help filter out any bacteria that might have creeped up in or around your urethra during sex. And this tip is also helpful for people with penises or who were assigned male at birth. It's easier for folks with vaginas or front holes to develop a UTI because of the shorter length of their urethra. But again, people with penises or who were assigned male at birth are also able to get UTIs. So always, always, always pee after sex. Take that tip, share it with your friends, spread that knowledge wide and far. And finally, if you notice any symptoms like pain during sex, itching, a foul-smelling odor, discharge, green or yellow discharge, fishy smell, or burning, you should definitely schedule an appointment to go see a doctor or medical provider and get tested. These are signs to look out for that might indicate infection or an STI, and can help you also diagnose your partner if you might notice that kind of thing. It can be really easy to miss a change going on with your body and to continue having sex or being sexually active during that time. So, just be proactive, pay attention to what's going on down there, whether it's for you or your sex partners, and, commit to doing regular gynecological checkups, including cervical screenings and whatnot, because that will go a really long way in keeping you healthy. So now into the new stuff for this week. We've just got some basic care tips for how to keep your vagina and front hole healthy and, infection-free. So first tip is always wipe front to back. When you use the bathroom, be sure to wipe from front to back. AKA you want to start up by your clitoris and urethra and move your way down with the tissue, and move your way towards your vagina / front hole and your anus or butthole. This helps keep bacteria away from your vagina and your front hole and away from your urethra. If you are wiping from back to front, you're literally putting your vagina and front hole and urethra in the line of fire of bacteria, and this can lead to getting an infection. So this tip is also applicable for folks with penises or who were assigned male at birth. Always wipe front to back. And on that note, the front to back tip also applies to sexual activities. So it's best to save any anal play or butt stuff for after you've wrapped up your vaginal / front hole / urethra or near urethra activities, unless you're planning to clean your toys or body parts with soap and water, or clean your mouth by brushing your tongue and teeth, or reapplied new condoms or barriers in the middle of your sexual activities, then you definitely want to use this front to back rule. All in all, anything that goes in or around the anus or the butthole shouldn't go in or around the vagina, the front hole, the clitoris, the urethra, unless it's been cleaned first. So if you're kind of like, what are you saying to me? Who wants to clean midway in mid-sexual activity? Stick to saving anal play and butt stuff and anything having to do with the anus for last. Our next tip is when you're choosing your underwear, try to go for cotton material underwear. Cotton is a much more breathable material and will absorb moisture from natural discharge more easily. Synthetic materials like nylon and spandex will trap moisture and help create environments where yeast infection and other bacteria can thrive in. And they can also be irritating to you down there. On a related note, you also want to be sure to change out of wet clothes as soon as possible. So, right after working out or after you've been in the pool or a hot tub, you don't want to linger in your sweaty clothes, and you don't want to linger in your wet swimsuit. This can also create environments that bacteria and a yeast infection can thrive in. So make sure not to hang out all day in your post-workout clothing or your wet swimsuits. Our final tip for today is to avoid scented products and soaps and detergents. I've heard from a lot of folks who have what I might call like an iron vagina or iron front hole, where they never get any irritation ever from any product, no matter how like heavily and fakely or fakely scented it is, and great for them. For other folks, there are scented products that cause irritation down there and can help kind of change the balance of pH. And so if you want to be less at risk for developing an infection down there, definitely avoid heavily scented products. Things that are often really heavily scented that come in close contact with your vagina or front hole include flavored condoms, tampons that are scented, pads that are scented, laundry detergent, lube sometimes, and then also super scented body washes, and also douching materials. So, figure out what lightly scented or no scent at all products work for you and stick with them. Now that we've kind of covered all of our tips, we'll go into kind of vaginal infections 101. The general term used for describing the symptoms one may experience from a vaginal infection or infections of the front hole is vaginitis. Noticeable symptoms can include discharge, itching, and or a burning sensation. The most common types of vaginitis are bacterial vaginosis, which is affectionately known as BV. This is a bacterial infection, which also means it's not a sexually transmitted infection. But it does happen after an overgrowth of healthy vaginal bacteria and a change in the vagina's pH level. This might happen after something like douching, which is why it's never a good idea to douche. Again, because your vagina or front hole is self-cleaning and doesn't need to be douched. So again, while BV isn't an STI, sex with a new partner or multiple partners can increase the risk of developing BV. This infection may cause white or gray discharge, but doesn't always have symptoms. So, be on the lookout for anything you notice that changes. And also just note that BV is treatable with prescribed medication. Next up, we've got yeast infections. So yeast infections can happen when there's an overgrowth of a type of yeast in the vagina or front hole. These infections are super common. And symptoms may include itching, inflammation, a thick white discharge that looks like cottage cheese. They can also be treated pretty easily with over-the-counter medications and antifungal medications, but if you commonly get yeast infections, you probably want to get the prescribed treatment from a doctor just to make it a little bit easier on you. And a fun side fun fact about yeast infections is that if you're prescribed antibiotics, there's a chance that you may develop a yeast infection after finishing your antibiotic treatment. So if you're prone to getting them and you're prescribed antibiotics, it might just be a good idea to ask your prescribing provider then and there to also give you a prescription for yeast infection medication. Our last main kind of vaginitis infection to look over is Trichomoniasis, also or affectionately known as Trich. This is an STI and it's caused by a parasite. It often shows up with a green or yellow discharge and a fishy odor. And it also might show up with some burning and redness. It's treated with antibiotics, but to avoid reinfection, both in all sex partners should be treated for it. And then while we're on the subject of infections, can't not mention STIs. STIs are infections that are transmitted through sex. They can affect the vagina or front hole and cause symptoms like discharge, genital warts, or sores. Some STIs don't cause any symptoms and are only found during regular routine STI testing. But that said, please call Whitman-Walker Health at 202-797-4439. The phone number is down pinned in the comments. And we can help you schedule an HIV or STI testing appointment here in our Northwest DC or Southeast DC locations. If you're not located in DC or if our locations aren't as accessible to you, definitely visit your local community health center, a Planned Parenthood location, or visit your local health department to get access to testing. And during a future Instagram Live, we'll go through more of the STIs in a lot more detail, but here are a few common ones to know by name. They include chlamydia, genital herpes, gonorrhea, and genital warts. Again, one more time, here are the signs to look out for. That means it's probably time to talk to a medical provider or schedule some type of medical appointment to check out what's going on with you. So if you're experiencing vaginal burning, itching, or pain, if you're experiencing green or yellow vaginal discharge or any change in color or the odor or amount of discharge that you're experiencing, go see the doctor. If you notice thick vaginal discharge that resembles cottage cheese, this is probably a yeast infection and needs treatment. If your vaginal discharge smells bad, or you're experiencing unexplained vaginal bleeding, or bleeding between periods, or bleeding after menopause, or bleeding during or after sex, these are all signs to go see the doctor. If you're experiencing pain during sex, or persistent vaginal itching, or just have any concerns about your vagina or front hole at all, schedule that doctor's visit and see what's going on down there. The sooner that you tend to changes in your vagina or front hole, the better and more likely you are to respond well to treatment and respond, I guess, more rapidly to treatment. Those are all the main tips that we've got for you today. I do want to clarify one thing that I said in my last live, which was that, as we're learning about the different age groups for vaginas and front holes and what happens to them at the different various stages of your life, we got to people who were in their 50s, but I should have said people in their 50s and up. So as you age, your vagina or front hole, loses some of its muscular toneness, and it's good to practice your Kegels. It's more easy to tear, so you want to use more lube and whatnot, but that applies to, all vaginas and front holes that are entering their 5th decade of life and beyond. So I just wanted to clarify that piece. And I also said that if you have regular sex, it'll help you, stay tighter and healthier down there for longer, essentially. What I meant to say was having sex regularly. So kind of keeping it part of your routine and keeping it consistently within your life will kind of help exercise that muscle and keep it strong and healthy and going. So yeah, if anyone's got any questions, please feel free to put them in the chat. Had a great time talking with everyone this week. And looking forward to returning next week. Next week, we're going to probably be talking about Women's History Month and respecting all women, and just how to honor and celebrate this month. And yeah. But, of course, before we go, we're still living in COVID land. So I wanted to give a few reminders about COVID-19 and the vaccines. I know the CDC recently shared that, masks are becoming less needed. But if you are indoors in tight spaces, you definitely want to wear a mask, especially if you're not vaccinated. But again, here are just a few reminders. The CDC had recently relaxed mask guidance, stating that you mostly don't need to wear a mask anywhere unless indoors and in crowded spaces. So yay for a literal breath of fresh air from the mask mandate. But if you've already gotten your vaccine, congratulations. You've taken a really big step in helping to prevent yourselves, your loved ones, and your communities from illness. The vaccine isn't 100% effective at preventing COVID-19 infections, but it does help prevent severe illness from COVID and being hospitalized from COVID and death from COVID. So thank you for that, and we appreciate you. And just still stay alert. Wear your mask if you're in tight spaces and you don't feel comfortable and you just don't know the status of other people who are around you in terms of their vaccination status. If you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has the COVID-19 vaccine available. Everyone ages 12 and up is eligible to receive a Pfizer COVID-19 vaccine. And everyone ages 16 and up is eligible to receive a COVID-19 vaccine, period. Please reach out to us at 202-207-2480 to make an appointment. And if you're having trouble making an appointment with us, or we're just not nearby you, in your DC resident, you can find information about COVID-19 vaccine walk-up locations and eligibility at vaccinate.dc.gov or by calling 1-855-363-0333. You can also track the speed of COVID-19 vaccination lines by visiting coronavirus.dc.gov/don't-wait. If you're a Maryland resident, you can learn more about the Maryland vaccine distribution process and schedule a vaccination appointment at covidlink.maryland.gov. or by calling 1-855-634-6829. If you live in Prince George's County, you can visit their vaccination portal, and if you live in Montgomery County, you can visit their vaccination portal, or you can call 240-777-0311 to schedule an appointment. Finally, if you're a Virginia resident, you can learn more about the Virginia vaccine distribution process and schedule a vaccination appointment at vaccinate.virginia.gov or by calling 1-877-829-4682. Now, if you haven't been vaccinated and you're not looking for an appointment, please continue to follow CDC guidelines for mask wearing, quarantining, social distancing, and the like. It's very important that you consider getting the vaccine and discuss COVID precautionary measures with those around you, but be mindful of masks and keeping your distance, but especially when you don't know whether the person you're near is vaccinated or not. Finally, remember to follow us on Instagram, Facebook, and Twitter at Whitman-Walker, and check our website at whitmanwalker.org for the most up-to-date information on our services. And for more COVID-19 resources and general Whitman-Walker services, please just call us at 202-797-4439. That number is again pinned in the comments where you can schedule your HIV and STI testing appointments. And feel free to follow our fellow Whitman-Walker family members at RealTalkDC_ and NoFilterDC. Thank you all so much and wishing you a beautiful rest of your week.